Namaste. I am Dr. Shama Kadri from Faculty of Physiotherapy and Diagnostics, and today in this video we are going to talk about the dislocation and subluxation as well as, which is a part of the orthopedics in the program of PPT system and DPT system as well as. So, as the dislocation and subluxation can occur in the joints, and as well as if there is any fracture, the bone can be dislocated or subluxate. Okay, so let's start. The joint stability depends not only upon ligaments and muscles, but also on the bony architecture of the joint. Dislocation, a complete disruption of the joint, and subluxation, a partial dislocation followed by relocation, can damage the ligaments, nerves, joint surfaces, cartilages, as well as the bone that makes up the joint. The most common dislocation and subluxation is spores occur to the shoulder, elbow, finger, and kneecap. In the shoulder, falling on an outstretched arm can cause either condition. Sign and symptoms. Pain is usually severe even upon the slightest of movement. Swelling and significant hemorrhaging occurs around the joint. Deformity, a visible deformity is usually present, although this may not be the case with the subluxation. The athlete, however, will usually report that the joint went out of the place. On-site management, price protect the dislocation, subluxation of the joint from further injury. Rest are the promote healing. Ice is definitely indicate, however, compression may elicit more pain, and so this may have to be avoided. Elevation also may difficult as it would require movement to accomplish. Immobilize the joint. Usually, the athlete will support the affected limb in the position of most comfort. Try to support this position in any way possible and transport the athlete to a medical facility. Medical referrals do not attempt to relocate, regardless of the temptation to help an athlete. Never attempt to relocate a dislocation. Physician referral is mandatory. Subluxations must not also be examined by the physician, as bone and ligament damage is also always associated with these injuries. Rehabilitation. After the physical has cleared, patient is sent to the rehabilitation for the physiotherapy. Activity will include active range motion exercises, strengthening and rotator cuff and postural muscles. Return to activity. As patient, so the physiotherapy is given as the active range motion exercises and strengthening the rotator cuff and postural muscles. If how return to the activity, the athlete should not return to activity until they receive any okay from the doctor side, from the physician, from the physiotherapist side. The athlete should use some form from the protective taping, strapping, and bracing upon return as suggested by the physiotherapist. Prevention. Vulnerable fingers, for example, can be tapped prior to practice and competition. proper standing of muscles surrounding the joint, example shoulder girdle, will help prevent shoulder subluxation and dislocation, as well as the dislocation and subluxation may occur over the fractured bone. It may reduct and manipulate and immobilize by as the physician under general anesthesia. So this was all about the subluxation and dislocation. If you have any queries related to this video, ask me in comment section. This video is powered by digital version of 2.0 Jyoti Vidyapeth Women's University. Namaste, Khush Rahiye.